Hey everyone, it's Hannah, the PBC Expo Midwife. In today's session, we're going to be focusing on pregnancy and covering some important topics, including choosing a care provider, options for testing in pregnancy, and important lifestyle and diet considerations to look at. So let's start at the very beginning and look at your pregnancy by trimesters and your due date. So in pregnancy, we divide it into 3 trimesters. The first trimester, which is from conception to 12 weeks, the second trimester, which is 12 to 28 weeks, and the third trimester, which is 28 to roughly 40 weeks of pregnancy. The estimated due date correlates with this 40-week mark. It's important to remember that your due date is an estimate. It's one day in time, and less than 5% of babies are actually born on their estimated due date. The normal range of pregnancy is anywhere from 37 to 42 weeks, and most babies will come in this time. So then if we focus back to the trimesters, you will notice different changes in your body as you progress throughout your pregnancy. In the first trimester, it's common for women to feel nauseous and to potentially even vomit a little. Although this can be uncomfortable, it is quite normal and is due to hormonal changes in your body. Having regular small snacks throughout the day and also having something to eat that's savoury before you get out of bed can be helpful to making women feel better. In the first trimester, you may also notice breast changes such as tingling or growth, and this is really normal as well. You may find that you're more tired and fatigued in this time as well, and that's really common in the first trimester as your body's changing rapidly and growing lots of new tissues. In the second trimester, this is the exciting point where you'll start to feel your baby move. So from around 16 to 20 weeks of pregnancy, you will start to feel your baby move, although this can vary depending on the location of your placenta and also whether it's your first baby or not. It will take a little bit longer for other people to be able to feel movements from the outside, but this is a really exciting time when you can start to feel those movements yourself. We recommend to settle to sleep on your side from 20 weeks of pregnancy, and most women also find in this second trimester that they start to feel better and more like themselves again. Now you've reached the third trimester. This is the exciting point where you'll meet your baby soon. You may notice some different sensations in your body. So some women will notice what we call Braxton Hicks or practice contractions. And that's when the uterus essentially has a practice run for labour. That can be quite sporadic and quite mild, but you might notice a tightening sensation in the uterus, and that's quite normal. You may also notice that you have some backache or some aching in your hips, and that's all due to the ligament stretching and your pelvis making space for your baby to move through the pelvis during labour. Remember that you are growing a baby, so it's important to be gentle with yourself and to remember that as you progress throughout pregnancy, it's quite common to start feeling uncomfortable, to be getting some aches and pains, but just go easy with yourself and rest when you need to. There are some important lifestyle considerations to be aware of during a pregnancy. So let's start with your diet. During pregnancy, it's important to eat a variety of different foods, and you actually need around 300 extra calories a day when you're pregnant. So it's not exactly eating for 2, but you do need to eat more throughout the day. So you can enjoy many of the foods that you probably would have eaten pre-pregnancy. So things like fresh fruit and vegetables, meat or meat substitutes, and also dairy. It's important to consider getting a variety of different nutrients. When you're pregnant, your body does have increased demands for iron and certain other nutrients. Folic acid is an important nutrient in pregnancy, and it's recommended for pregnant women to take a supplement for 2 months prior to pregnancy and the first 3 months of pregnancy. The dose can vary depending on your medical history and what medications you're currently on, so I recommend discussing this with your midwife or GP. Iodine is another important nutrient, so it's important to make sure that you have adequate iodine in your diet or to ensure that you're taking a pregnancy multivitamin, which includes this as a supplement. These vitamins are both important for your baby's development. Now we've talked about foods to focus on, but there's also some important foods to avoid during pregnancy. And this is to reduce the risk of salmonella or listeria, which is commonly referred to as food poisoning. So these foods include deli meats like ham and salami, soft cheeses, pate, undercooked meats, raw seafood, things like that. It's important to avoid these high-risk foods during your pregnancy. It's also important to remember to wash your hands really well before preparing food. And we also recommend to avoid alcohol and smoking during pregnancy because these are known to have adverse effects on a growing baby. Exercise in pregnancy has many benefits, and most women can continue to exercise throughout their pregnancy. Some women, due to special considerations in their pregnancy, may be recommended to reduce the intensity of their exercise or to even stop completely. So it is important to check with your healthcare provider. But for women who are experiencing a healthy pregnancy, exercise can be really beneficial. Things like swimming, walking, yoga and Pilates all help you to build strength that you will use during your labour and also help you to keep active during your pregnancy. It's important to be aware of the intensity that you're exercising at. This should be moderate intensity, so you should be able to hold a conversation. If you find that you can't, then it's important to reduce the intensity or to take a break and rest. You also want to make sure that you avoid getting too hot. So just be mindful if you're exercising in a hot environment, and also avoid spas and saunas during your pregnancy. Now that we've covered the basics, let's look at choosing a care provider. This is one of the most important decisions that you will make in your pregnancy, but it's really important to ask yourself a couple of questions first. So the first thing that I would encourage you to think about is, how do you see pregnancy and birth? Do you see it as something that is natural and something that your body's designed to do, or more something that needs medical support and management? The next question that it's important to ask yourself is, what kind of birth do you want? And I know this can be quite far ahead in the future, but some of the choices you make with your care provider early on can influence the options that you have available during your birth. So think about what kind of birth you'd like. Would you like a water birth? Would you like an epidural or a cesarean? Are you planning a natural birth? Consider how you'd like your birth to look, because this is really important when you look into your care provider options. So there's a number of different options for your care during pregnancy. So what we talk about as continuity is the gold standard. When choosing a care provider, continuity of care can be really beneficial. So what continuity of care means is knowing your provider, knowing the person that's providing your care during pregnancy, your labour and birth, and the postnatal period. For most women, the best way to achieve this is through continuity of care with a known midwife. This means receiving that care from the same midwife or small group of midwives throughout your entire journey. This has many benefits shown in the research, including a lower chance of interventions during the birth, higher breastfeeding rates, and women having higher satisfaction levels with their birth as well. So we know that there are lots of benefits. There's lots of options for achieving midwifery continuity of care, and I would encourage you to explore the options available in your local area. This might be through a midwifery group practice program, a private midwife, or maybe a caseload program that is offered through your local public hospital. Another option for care during your pregnancy is from an obstetrician. So an obstetrician is a doctor who is specifically trained in pregnancy, birth, and the postnatal period. Some women will have care from one obstetrician throughout their pregnancy, others will receive care from a small group or from different obstetricians. Some women also choose to receive care from their GP or their general practitioner during their pregnancy, and this is sometimes referred to as shared care. This can be a great option if you have built a really great relationship with your GP and this is something that's offered in your area. Remember that choosing a care provider is a really personal decision, so it's important to look at all of your options and think about what provider is most suited to you and the type of experience that you want. What kind of support do you feel you would benefit from? What kind of birth would you like? Because depending on your care provider, there may be some different options offered in there. When you decide on a care provider and you have that first meeting with them, make sure you have a really good discussion with them around how they see labour and birth. What's their philosophy? And make sure that this aligns with your philosophy for your birth. It's also really important for women to know that in Australia, we have the option whether we choose to have care from a midwife or a doctor, or a combination of both. So some women will just see a midwife during their pregnancy. Midwives are really trained to be able to provide that full scope of care throughout pregnancy, labour and birth, and the postnatal period. And they are what's referred to as that gold standard for achieving continuity of care, because they will be there through the whole process. Unfortunately, with obstetricians and doctors, they're usually only just there for the birth. So while they're an amazing care provider and a great resource, you'll still need to have a midwife providing some of your care in labour. During your pregnancy, you'll be offered a range of different tests, and it's important to discuss these with your care provider to decide what might be right for you. Remember that it is your right to be fully informed about any test that's offered to you, and it's also your choice if you wish to decline any testing. One of the first tests that you'll be offered is called the first trimester screening, or NIPT, which stands for non-invasive prenatal testing. Both of these tests are looking at assessing your risk of having a baby with a chromosomal disorder. This is something that is offered to women in the first trimester of pregnancy. From there, you'll also be offered a number of blood tests, and this will be some in the first trimester to look at things like your blood group, your iron levels, things like that. Then also later on in pregnancy, you'll be offered a gestational diabetes testing, which involves drinking a glucose drink, and then a blood test as well. And this is usually done around 28 weeks of pregnancy. You'll also be offered a number of ultrasounds during your pregnancy. The first is usually around 12 or 13 weeks, and the second is usually around 20 to 22 weeks. And this is to check an important number of structures in your growing baby. From there, depending on your pregnancy and your provider, you may be offered other ultrasounds as well. It's also recommended that all women have the whooping cough and flu vaccine during pregnancy. This is really important as it can help to provide antibodies to your baby before they can receive their immunisations once they're born. So with all testing options, it's important to do your research and decide what test might be right for you during your pregnancy. If you have any questions, direct them to your midwife or doctor so that you have the information to make a really informed decision. Building a positive mindset for pregnancy and birth is really important, and it's important to start working on that early on. There can be so much fear when it comes to labour and birth, but for the majority of women, pregnancy and labour and birth is a really straightforward and a beautiful process. So doing things like reading positive birth stories, watching beautiful birth videos, completing independent childbirth education, things like that that help you build trust in your body and your ability to birth your baby can be really beneficial during your pregnancy. Avoid the horror stories and conversations that create extra fear. It's just not helpful when you're pregnant, and maintaining that positive mindset is really important. Do your research and build knowledge about your body and what to expect during labour. And if you have any specific questions, make sure you ask your midwife or doctor so that you're feeling really informed and prepared.